One, two, three, go.
Hello, I'm Dr. Maram Muhammad. How have you been doing?
Well, I'm fine. I'm fine.
Can you tell me how can I, say your name?
You can call me Christine.
Okay. Christine, your GP has been worried about you.
Well, yeah, because my blood sugar is not controlled, and he said that I must talk to you about this issue.
Yeah. Do you know why your blood sugar is not controlled?
He said to me that you're not controlling your eating, and there are something which you should eat, things you should not do, and so on.
Mm-hmm. Mm-hmm. Have you been taking your insulin?
Well, I stopped taking insulin actually because I wanted to diet, and taking insulin was not helping me to lose weight. Everything was okay,
Mm-hmm.
by the way. When I stopped taking insulin, nothing happens. But the problem is that sometimes, I eat in a stupid way, and then the blood sugar raises without the insulin, and I go to the hospital.
Oh, it seems like it's tough. This is not your first time going to the hospital then?
Yeah, no.
Okay, and it's because of the same reason that your blood sugar was high?
Yeah, always the same sequence.
Always the same sequence. Can you tell me more about, you said eating. Can you tell me
Yeah.
more about your eating habits?
Well, the problem is that I don't have any problem with eating, except that sometimes, doctor, that's whenever I'm stressed, I just eat in a very bad way and eat a lot of amount of food. Then I regret this. Though while I'm eating, I feel satisfied. And after that, I just feel so sorry and that I feel awful. And I try to get rid of this food. I try to do some exercises. And whenever I'm stressed, I have this stupid behavior.
It seems like this is very, very difficult for you. How long has this been going on?
Well, this maybe have been going on for about 6 years now.
6 years. Did anything happen before the 6 years?
Well, nothing. Is like what?
Were there any problems in your life?
Yeah, I remember before that, there was a problem. I was in the high school, and they made fun of me because I was rejected from the gymnastic team, and I decided I want to eat, and then I vomited, and since then this has been going on.
Yeah. Well, what were they making fun of you about?
Because I was not my weight. I couldn't lose weight enough, because we were supposed to lose weight in order to join the competition, but I couldn't.
Mm-hmm. Mm-hmm. Do you have an ideal weight in mind?
Well, my weight now is 65. I think if I am 58, this can be good.
Okay. So this has been going on since 6 years, and it seems like it's been getting worse. Would I be right in that?
Well, it's the problem that I got diabetes, and so this has complicated matters. There was no problem because of this habit, but because of diabetes, that whenever I have this eating bouts, my blood sugar shoots up.
Yeah. I know you mentioned something about vomiting after eating. Can you tell me more?
Yeah. Well, after I ate too much, I sometimes I try to get rid of what I ate. I go to the bathroom. I just put my finger in my tongue, and I just get rid of what I eat.
And you vomit. Okay. Did you try any other way to compensate for the eating?
Well, yeah. Exercise. This is a typical, but the many times I just try to vomit.
Okay. Anything else other than the exercising and the vomiting?
No.
You feel like you have control over eating.
Well, during these periods of overeating, no, I don't control, but in between them, I control everything.
Okay. I'm wondering, how do you see yourself? How do you see your body weight?
Well, I feel now that my body weight is not ideal, and definitely this is the best, not the best shape of me. So if I can lose maybe 7 kilograms, which is not too much, I'd be satisfied.
Mm. Okay. Okay. Have you ever tried to restrict your food?
No, no, no.
During this difficult time, how has your mood been?
Well, I've been frustrated maybe for about 3 weeks now. I'm so down.
Yeah, that makes. How would you say people say can describe your personality?
Well, well, many of them say that I'm a bit impulsive.
Mm,
Yeah.
okay. Can you tell me how you're coping with this difficult time?
Well, basically, I just try to control my weight. I try to look good. I try to do just 1 minute remaining.
Okay. Have you tried, maybe self-medicating with alcohol or any drug?
No, no.
Okay. Have you had any thoughts about harming yourself?
Well, I used to do this, but I stopped actually.
Do you still have thoughts about hurting yourself now?
No, no, I stopped. I used to cut my hand, but I stopped doing this.
Okay. Is this your first time visiting a psychiatrist?
Yes.
Okay. Did your family ever go to a psychiatrist?
Yeah, my mother had that anorexia, used to that. Had anorexia.
Mhm. Well, thank you so much for talking to me, Christine. It seems like you're dealing with a problem called bulimia. Would be happy to help you out. I would love to talk to you more and give you some leaflets about it.
Very good. How do you feel about what we did? I hope that we have a feedback in our chat section from our colleagues. So, first of all, doctor, please don't don't do this ever in the exam. You are supposed to be professional, so no high. Don't do this, please. Number two, there are sensitive issues from, according to what I know from the culture. It is not our culture. However, I've been told that the body image and eating habits are sensitive issues, like exactly when one talks about the drug history or alcohol history or something related to the intimate life relations. So when you talk about this, I would like just to ask you, say something like, I would like to ask some sensitive question about the issue of eating and body weight and self-image. Is it okay for you? Okay, so take permission when we talk about this issue. Number three, the attacks of bulimia, please. I said to you that pay attention. I said that I'm feeling down 3 weeks ago. So the story goes that this lady has been done by her boyfriend 3 weeks ago, and since then she started to have attacks of bulimia. So yes, the story started 6 years ago, but this attacks was precipitated by her boyfriend. Okay, and ask about that time the numbers of the bulimic attacks in the patient's life. Okay.
Mm-hmm. Okay.
The doctors, Patra, she did risk assessment. Me, number 5, Sheena, okay. Let's see, according to our mark sheet. Okay, so here is the complaint which you should take professionally. This is the first thing you should do. The onset, this is something we should. How was everything during? You said before that, and then the course and the duration. But the only thing is that you want, because the bulimia comes in attacks. It's not a persistent disorder. Nobody goes on in his life with bulimia. He has attacks of bulimia, and every attack is precipitated by something. And it started in his life with something, but it comes in attack. This attack was precipitated by something. So this is what you should ask about. Okay. And then you ask about the symptoms, syndrome in a very good way. And then you ask about the comorbidity. Did you ask me about my mood and so on?
You asked about mood.
Did you ask about any stressors? So if you have asked about the comorbidity, if there is any morbid social stressors, you ask about the mood, how is your energy and everything.
I just asked about the mood.
Oh, so
No, I didn't go into
so if you have asked about the comorbid stressors, you would have picked that this lady is stressed because her boyfriend has left. You ask about the impact and coping and risk, the past history and family history, and then eventually deliver the diagnosis. Let's see your mark sheet. So you identified the issues, which is the eating and so on, the aspects of history, which is the complaint, symptom syndrome, the comorbidity, the past history, family history, etc., impact, coping, risk, everything you paid attention to. Does not elicit presence, you explored enough in the history of the details of the syndrome, so 0.3 is going to be scored. You ask about the risk, so 0.4 is going to be scored. You paid attention to my health view. Yep, I felt that you were keen to understand my point of view, so 0.5. So point number 6 is the point which might not be scored for you because you missed social information. Though you ask about the psychological, I know, but in this particular syndrome, which is bulimia, the social information are very important.
Yeah.
Okay.
Okay, so it was organized. The consultation was not formalic. Your attitude was good. Your listening skill was good, and everything was good in your performance. Very clever, mashallah. Thank you so much, Dr. Maram. Very good. Thank you. So who would like to go next? We have a list, so I hope that we. I think Dr. Sami is the one who should do it.
Yeah.
Okay,
Sam, hi, how are you?
Alhamdulillah. So what is your station, Dr. Sam?
It's vascular dementia history.
Okay. Give me 1 minute.
Yeah, okay.
Vascular dementia. Let's start.
Hello, Mr. Brown. I'm Dr.
No,
Sami.
I will just set the time. Wait, 1, 2, 3, go.
Hello, Mr. Brown. I'm Dr. Sami, one of psychiatrists working here.
Hello.
I understand that you have some concerns that GB referred your father, Mr. Adam, to us, and I'm happy to discuss this issue with you. Is it okay?
Well, doctor, the problem is that my father is very forgetful now. I don't know what's the problem, and I discussed this with the GP. He said that we must talk with you.
Yeah, I'm so sorry to hear that. It looks hard to you to see your father in this situation. And I wonder when did it started to be forget things?
No, this problem started about 2 years ago, but now he is very forgetful.
Did you notice anything else?
Anything else like what?
What I mean is, did you find that he, during a conversation, find words?
Yeah, but sometimes I feel that he doesn't know the name of simple things like cup and table and chair.
Okay. Did you notice also his ability to recognize common objects and familiar faces?
No. He so many times he doesn't know his grandfather and grandchildren.
I'm sorry to know this. Is he still able to take care of himself and live independent?
No, at all. Now we need to take care of him, doctor, most of the time.
I'm sorry to know this. Mr. Brown, did you notice any change of Mr. Adam mood?
Yeah, sometimes he's crying for no reason, and I feel that sometimes he's depressed.
Yes. Okay. Anything else? Did you notice the mumbling by himself?
No, no.
Okay, great to know this. Any abnormal behavior?
No, actually, no, I don't think that he has any behavior now. Problem that he does not behave in any way now.
Okay, what I mean is he is become aggressive.
No, 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 no.
Okay. Did he drink alcohol?
No, no, no.
Okay. Any illicit drug?
No.
Okay, great to know this. Mr. Brown, did you find that Mr. Adam is risky to himself?
Yeah, sure, doctor. Sure, sure. He stumbles too much, and yesterday woke up. We did not find him, but the police brought him back. Thank goodness that one of the neighbors found him wandering in the streets.
Oh, I'm sorry to know this. Is he still able to finance, understanding
No, no,
his
no,
finance?
no, 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 no. What at all? I cannot do any of these.
Oh, did you notice any abnormal movement?
No, no, no.
Experience any fall?
Yes, he's falling. I said to you that he is falling.
Oh, I'm sorry to know this. Is he still driving, Mr. Brown?
No, 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 no.
Okay. Regarding to risk, what I mean, if he like fire opens the stove, switching off the stove and forget it.
No, he doesn't go to the kitchen, and we stop. We prevent him from using any of the electrical devices to prevent him from doing
Okay. Okay, great to know this. Is there any history of past psychiatric problem?
No, no, no.
Did he suffer from any physical problems?
No. Physical problems, yes, doctor. He has been admitted to the hospital several times.
Okay, for what?
Well, he had stroke, doctor, several strokes before.
Oh, I'm so sorry to know this. Did you notice that with each stroke, his ability for memory become deteriorated?
Yes, exactly.
Okay, thank you for sharing this important information. Just to recap, Mr. Brown, I understand from what we speak that Mr. Adam suffering from memory problems, and he is unable to take care of himself and live independent, and he is sometimes risky to his
1 minute.
himself. Okay, I need to sit with Mr. Adam to do some blood test and brain imaging, and also we need to do memory assessment. Is it okay with you?
Yeah, no problem.
Okay. Thank you for coming today, Mr. Brown, and sharing this important information. I think that Mr. Adam have a problem with memory called dementia, most probably due to vascular, problem with vessels. It's called vascular dementia. And
okay, thank you. Shukran.
thank you.
Okay, so how do you feel about what you did?
I don't know. I think if I missed something.
Okay, so what did we say whenever you are going to take history taking? What do? We don't go through the details of the complaint. We want to take the complainer professional way, the onset course duration, the circumstances around the onset, and how the patient was doing before the onset. Because if you did this, you would have picked up that this man has vascular problem and his memory problems are related to physical problems. Okay. So you just noted that it started 2 years ago, and then you went through the details of dementia without taking details of how the onset started, how the patient was before the onset, and what was the course of this memory. Okay, so you would have, if you ask about the onset, course, duration, the complaint, as we always say, you would have picked up many things, and you would have because. And by the way, how to take the complaint is one of the aspects of the history. So if you don't take the complaint properly, this means that your scoring is not going to be good. Okay, number 2, when you assess the dementia, the first thing you do is you want to know what type of memory loss he has. Is it for recent or remote? So we asked about everything except with the type of memory which he has, the type of memory problem which he has. You ask about the language, you ask about the visual spatial, the movement, the personality, and what else? I think you asked about the agitation, executive functions, okay. And you mixed up the management, the history, the aspects of the syndrome with the risk. But anyway, when you start assessing the memory, the dementia, first thing is to ask about the memory and what is the type of memory in which he is having a problem with. Is it for recent event or remote event? The patients who have dementia are good with the remote in comparison to the recent. In the later stages, they have total dementia, however, but in the beginning, they have you have good memory to the recent than the remote. For example, those who have depressive pseudo dementia and depression, they have total dementia. Okay, in the beginning. So, number 2. When I said to you that we are the one who take care of him, so in what level? Even in going to the bathroom, or just take care of him in finances? Pay attention to what I'm saying. Okay, so you said that what level? Do you even going to the bathroom? Okay, so and there are particular points regarding the vascular dementia which you should know. Those who have vascular dementia are common to have movement problems. Okay, maybe they can limping, their movement is much weaker. Okay, it is more common in them to have a bowel and bladder problems. Their sphincters become weaker. Well, definitely, it's a stroke in the brain, so it might affect these areas. Number 3, they are more prone to have mood problems. Okay, so this is what you should pay attention to with this type of dementia: the movement problems and the mood problems. Please mute your mic, please. Movement problems and the mood problems and the sphincters. Very common in them, these types of problems. Number 2, please. Doctor, please. This is an examination for your communication skills. It's not an oral exam to see whether you know the information or not. So your communication must be better, because I feel sometimes that you have a lot of pauses. Sometimes I feel that you are searching for the words to express yourself. They assess you as a candidate who is able to sit in the real clinic and have good communication with their patients. So if you do not pay attention to this, even if you have the good information, your passing chance is going to be less. I felt that you are pausing while you are saying the sentence, a lot of pauses, as if you are searching for the words and you are looking around. If you are going to do a station, please write it down, prepare it, prepare the sentences which you are going to use. Even those who have average language level, my language is not that perfect, but I passed, and many others passed. But they need to work on their language and their communication. Okay. Eventually, when you explain the problem, try to have more fluent explanation. Okay, I felt that you were struggling. If you are going to explain, you are the one who decided to explain. Okay, just simply you can say that this is a type of dementia, which is called vascular dementia, because the blood is not reaching the brain because of a problem in the blood vessels. That's why it is called vascular dementia. This is enough. Very simple. accurate. You don't need more than this. Okay. Let's see the feedback of our colleagues. Balance and false risks. Yeah, very important, Dr. Rizwan. Yeah, balance. They have problem in their movement. Maram, yeah, very good feedback. Please pay attention to what she is saying. Okay. Let's see, according to our mark sheet, to our the history taking slides. So as you can see, doctor, this is how you start the station. Are you with me, Dr. Mohammed Sami? Where did you go? Okay.
Yeah, Dr. Hassami.
So this is how you start. Now, this man is saying to you that his father is having a memory problem. So we want to know exactly how did it start? Okay, how did it progress? Okay, what increased, what is the explanation? How was the patient doing before that? And while you are taking the complaint, definitely you will feel that there is a very close correlation between the memory problem and the physical problems which he has. Okay, and after taking the complaint, what you do is that now you want to ask about the symptoms of syndrome. I know that the problem is that the dementia affects all the brain faculties. So I think I gave you the acronym of Love Map, you know it, which helps the candidates to understand what is the, everyone knows, or do I need to write it down again? Okay, so we have this acronym Love Map. So we have language, and we have orientation, visual, spatial, and executive functions. And then LAB stands for mode, movement, and we have the apathy, attention, and eventually personality. Okay. Okay, so these are the points which should be covered in the history taking of dementia. And definitely you should ask about the memory. This is apart from the memory, which is the first thing which you should start with. Any questions about this acronym? Okay, so now, as for the comorbidity, this is a very important point in this particular station, not only the psychological, whether there is any underlying physical problems. This is very important in this station, Dr. Mohammed Sami, to ask about the comorbidity. Does he have any blood pressure? Does he have any high blood sugar level, any heart problems? Because the management, as we all know, depends upon correcting these underlying medical problems. Dementia is not a corrected problem. Okay, the impact, how did it affect his life? You ask about the risk. And then you past history and family history. You would not ask about them if there is anyone in the family who has dementia, anyone in the family has any medical problems. Is it the first time for him to have any psychiatric problems? I think you ask about the past history. And then eventually you deliver the diagnosis. Let's see the mark sheet rapidly. So unfortunately, you did not identify the issue because you did not start by the complaint. So this is what you get when you just jump to the details of the syndrome, because you know that this is a vascular dementia station. You don't pay attention to the complaint, and you just do a checklist, the assessment of the symptoms and signs. You recognize the symptom aspects of history. I think you covered enough details, the symptoms, the risk also. Pay sufficient attention to the physical health view. Yes, you asked me about this, but unfortunately the social and psychological information were not asked. It was a bit disorganized. Your language, unfortunately, doctors do not underestimate. When I talk about the language, doctor, this is serious. This is serious, particularly for the international medical graduates, because as you can see, in every station, there are 2 points for the language. These 2 points stands for not less than 16.5% of your assessment. You understand this? Can you imagine the amount of points for the language? You might say that, no, I'm a doctor. This is not an English language. I don't care. This eventually, this is your mark sheet. And this maybe this can stand behind that why the international medical graduates have difficulty in passing, because they don't pay attention to the language. Okay. And you must know that sometimes candidates do not pass by 0.5%. They don't pass, and whether they ask for a tribunal or anything, they don't pass that. The results do not change. So when you have 2 points accounting for 16.5% related to the language, so you must pay attention to how you talk, how you phrase your question. Pay attention to this, please. Unfortunately, doctor, these 2 points are not going to be scored for you. Okay, thank you so much. I hope that this is not frustrating you. I'm trying to help you as much as I can, and I know that you do better. Okay, thank you. Who would like to go next?
I'm Dr. Taba, but I cannot open my video. It is saying you cannot start your video because the host has disabled it.
Okay, I will not disable you. Okay, let's. Okay, you can start. Assalamu alaikum. How are you, doctor?
I'm good.
So what
Can
is
I
your
start?
station? Yeah, what is your
My
station?
station is about alcohol history.
Alcohol history. Very good, doctor. This is a very important station. Please don't forget some important things, that alcohol intake is a sensitive issue, so you must approach it in a sensitive method. Ask about the comorbidity. In the course of alcohol intake, there is, if you have been in contact with addicts in general, there is a particular point in their history in which the substance misuse has escalated for some reason, maybe some stressors, being in with someone who is taking drugs somehow. So you just make sure that since when his current intake has increased like this, and maybe you'll discover that started 2 years ago because of something like this. Okay. Good luck.
Okay.
Just say that my name is Robin. 1, 2, 3, go. Go.
Hello, Mr. Robin. I'm Dr. Taba, one of the doctors in the Department of the Psychiatry, and your GP actually referred you to us, and he has some concern about your blood test regarding the liver function test. Can we have a talk about it?
Yeah, no problem. No problem.
Okay. So first I would like to ask you what is your why you came to me? Do you have any idea about it?
You just said that I came here because of the blood test problem.
Okay. Okay, thank you. And Mr. Robin, can you tell me that did your doctor told you what is the possible cause of change in the blood results?
Well, he said that it would be better that I have a talk with you. I asked him what is the reason. He said that you are going to explain it better.
Okay. Okay, thank you. Yes, before I just explore your mood, I would like you to ask about your drinking habits. Okay, so can you tell me that for how?
Hello, hello, hello. Thanks. أيوة محمد. أيوة أوكي. طيب ممكن تبعت لي ملفك على جناح 8 بعد إذنك، وحط لي في كل ملف Sorry. Sorry.
Hello.
Hello. Yes, we can.
Okay.
You can progress. You can proceed though.
Yeah. Okay. Yeah. So Yeah. Can you tell me more about your drinking habit, Mr.
Well, it is
Mr.
not a
Robin?
very good issue to do. I'm drinking too much, I know.
Okay. And when did you start drinking first?
Doctor, alcohol has been always in my life. My father used to own a pub, so I think the first time I drank maybe at the age of 13, 14.
And what did you start drinking?
Well, it was just small amounts, beer behind my father, but later on, definitely this was not the case.
And can you tell me that how much you are drinking now?
Well, no, I'm horrible, doctor. Maybe sometimes I drink 1.5 bottle of vodka every day.
Okay. Do you think that it is above the limit which you are recommended?
Well, I feel that it's too much. I don't want the limit, recommended
Okay.
limit.
Mr. Robin, can you tell me that how the things have been changed since the time you first started drinking?
What things have changed? I don't understand the question.
I mean, the change in your life, is there any change in your life you noticed which made you to increase the drinking alcohol?
Well, the problem that 2 years ago I started a new job, and it is a very good job. However, it requires me dealing with very annoying customers, and drinking alcohol helped me a lot in the beginning to calm down and to know how to talk with the customers. However, with time, I don't feel that it is helping me anymore. I feel that it is a problem.
Okay, I can see that you had a difficult time at that time. Okay, and can you tell me that do you drink alone or at home, or do you go in the pub?
No, I prefer to drink alone, but sometimes I go to the pub.
Okay, okay. And can you tell me that do you find it difficult to control the amount of alcohol to use?
Yeah. Every day I decide not to drink too much, but eventually I end up with a bottom half every day.
And do you think that the alcohol is the more important thing in your life compared to the commitments you have in your life?
Yeah. In many times, yes. Many times I feel that I lost many commitments, social activities, and even going to work sometimes I'm not able because of alcohol.
Can you tell me about that? Did you ever need to take more alcohol to get the similar effect similar effect from the alcohol which you used to take before?
Yes, exactly. Yes.
Did you ever try to stop drinking?
Yeah, I tried several times, yes.
Okay, then what happened?
I feel horrible, doctor. I feel shaking and sweating, and I feel nauseated.
Okay, and can you tell me, did you ever miss drinking alcohol?
1 minute, a minute. Miss?
Okay.
Yes, I actually, no, doctor, I didn't have the chance of missing it. I just drink all the time.
Okay, and did you had any kind of a bad tremors, loss of consciousness, or
No.
any went
No.
into the fit? Okay,
No.
and did you had any problem with the law?
Yes, several times I was driving under influence of alcohol, and this was not good.
Okay, can you tell me that how has been your mood, your sleep?
Well, I just sleep by alcohol. This is how I sleep.
Okay, and did you ever had like some people when they are under the stress, they feel that the life is not worth living. It is in your case.
No.
Okay. Did you ever had any unusual thoughts or unusual kind of experiences?
No.
Okay. Okay. And can you tell me like anyone in your family has a drinking problem?
No.
Okay. So thank you, Mr. Robin, talking to me. I know that is quite distressed. You must be having a very distressful condition at the moment. But I have some leaflets and information for you to read, and there are some
Time.
support group.
Time. How do you feel about it? I hope that we have feedback from our colleagues. Let's all have Dr. Tayeba. Yes,
Okay.
she used a lot of closed-ended question, was bit checklisty. Dr. Vijay, current drinking, longitudinal drinking pattern, dependence criteria. Yeah. Medical, he did not ask about the medical. Dr. Vijay, it was very nice. Yeah. Motivation, very good. Yes. So.
I wanted to ask about, but
So,
I
Doctor,
think that yeah.
So pay attention. Okay. How do you feel about what we did? Give me your feedback.
For me, actually, I need to ask about the contemplation and pre-contemplation, but I think that I run out the time, maybe. Because I need to ask, like, at the end, I need to tell that, do you think, Mr. Robin, that you might have a problem with the alcohol? And then if he would say yes, then I should tell him that what make you think so, and how could we help you, and are you ready to quit the alcohol drinking, and that way. Okay. These things I didn't ask actually.
Give me just a minute. Okay, so I'll give you feedback. So the first thing, you must have very good introduction. You introduce yourself and explain to him why this setting is happening, and you should do it very assertively, because I found that you were struggling to do this, and this is not good. This is the very first second in which you do something in your station, so definitely you don't have any excuse to do any mistakes in them. Number two, you do not explain the blood test, and this can be a very useful entry and will help you to start the conversation for the disrupted blood liver function test. And you can say to him that this most probably can be due to drinking, and I would like to discuss with you this sensitive issue. I know this can be a bit sensitive, however, this is for your own safety. So you just use it and try to approach the alcohol drinking in a sensitive and empathetic way.
Mm-hmm.
I don't know, you asked some questions which I don't understand. What are you drinking alone? Do you feel that it is above the limits? Why are you asking? So instead of this, you could have asked the case questions. Have you ever felt that you need to cut down, getting annoyed whenever someone talks to you about your drinking, guilting, eye opener? So these are questions which has no value in your evaluation, okay. And seems that you will give an impression that you don't know how to evaluate an alcohol problem. So instead of that, I expected you to ask about the control, loss of control, compulsion. If he feels that everyone knows that he is drinking and he used to drink, the drinking habits, everyone is annoyed because of it. Okay, and if there is now drinking more and more frequently, the repertoire is narrow. Okay, and drinking despite of problems which might be there, whether he has any you ask about tolerance, and you ask about the withdrawal, and you ask about the abstinence. Other than this, I didn't feel. You ask about drinking despite having problems. What else? Only CCC, sleep, yes. I think this is enough. And then your language, again, doctor, I felt many times that you were searching for the words to talk and express it. This is not an oral exam, doctor. It's very important how you present yourself. Eventually, when you terminate this station, many candidates find it difficult. Sometimes you can simply say to him, so I really appreciate sharing with me all this information. How do you feel about talking with one of our team members who can help the patients who have problems because of alcohol and substance misuse or alcohol problem? How do you feel about talking? You don't say to him that you have alcohol dependence, never say this. Or you should stop drinking, never say this. At the end, you can say to him that it seems that alcohol has affected your liver functions. How do you feel about talking with one of our team members who are specialized in helping the patients who have problems because of the alcohol? That's it.
Okay.
Cover a lot of depends. Okay. I hope that you pay attention to the feedback of our colleagues, which is very important. If their feedback is very good. I'll just give you a rapid evaluation according to our slides. This is the history taking, and that's it. So how did it all start? You asked about it, and then you asked about the course and the duration. And here the predisposing and the precipitating factor. This man has grown up in a place in which everyone is drinking, a pub. And then the symptoms for syndrome, very important to know exactly what are the symptoms of alcohol dependence. Please pay attention, don't ask questions which has no value. If you want to ask the case, okay, there is meaning for the questions or the case. But when you ask, do you drink alone? What is it? Do you feel that it is above the limit? These questions are totally maybe, but I think you might be scored negatively for them. Okay, comorbidity. You should have asked if there is any comorbid depressive symptoms. It is not uncommon among those who have this problem to have social phobia and depression. Social is very important, and physical also. The comorbidity in this station is very important for a doctor. So you know that this man has physical problem in the liver. Maybe he has other physical problems. You don't know, but as long as there is alcohol, you should have asked. Impact, coping, and risk. How did it affect his life? You asked about if he has been in any risky or any situation which raised concerns about his safety. You asked about how did it affect his life. I think you asked to some extent if he has missed any important appointments, but you could have asked it in a better way. For example, so do you feel that it has affected, alcohol drinking has affected your life in a negative way? Because it is not only about missing an appointment. Now he has problems with his wife. He has financial problems. So it would have just simple alteration in your question. Just make it an open-ended question, not a closed-ended question about missing an important situation and so on. Past history and family history. Didn't ask about family history of substance or alcohol dependence, which is very common in those who have alcohol problems. Okay. Past history, very important to ask if there is any other types of alcohol or any substance misuse. And eventually you should deliver the diagnosis. Here, as I said, delivering the diagnosis is not saying that he is alcohol dependent, but hinting that he needs to talk with someone who has someone from the alcohol misuse team, because he has problems from the alcohol intake. Never say that he is alcoholic or drinking too much or he is alcohol dependent. Don't do this. It's not recommended, and eventually it's not professional. Okay, so let's see according to our mark sheet. You identified the issues and priorities. Well, aspects of the history, you missed some important aspects, like the comorbidity point 2 is not going to be scored. You elicit enough in the symptoms. Yes, you elicit enough of the symptoms. You evaluated the risk. Physically, unfortunately, you did not ask. The physical and psychological 0.5 and 6 are not going to be scored for you. Well, it could have been better organized and better presented. And again, the points of the language might not be scored for you. Dear doctors, pay attention to your language. I've been told that the CAST is formulated that at least the candidates who pass should at least score 7 in the IELTS. how much this information is valid. But as you can see, there are 2 points in the mark sheet related to the language. So don't go to this task searching for the words in the air and I'm not fluent in your evaluation. Depending that already I know the information and I asked about the criteria of alcohol dependence, and that's it. And you think that you're going to pass and it end up that you do not pass. Why? Because you are not fluent. Your consultation is not what they are asking for. Thank you so much. Don't get frustrated. I'm just telling you what to do and not what to do. Okay, thank you.
Thank you. Thanks a lot.
Okay, so who is going to do the next station?
Hello, Dr. Hussam. This is Mirat here. I was just wondering, like, is it okay if I go for the station now, or do I need to wait? Whatever.
Well, no problem, but I think we have Tayyiba and then Laila. This is the turn of Laila. If Laila is willing, is okay for.
It's okay, she can be with the station.
Are you sure? Or...
Yeah, it's okay.
Thank you so much. Thanks a lot.
Who are you? You are Mirat?
I'm Mirat, yeah.
Yeah. Okay, so what is your station, Dr. Mirat?
Autism.
What is your station?
Station number 73, autism history taking.
Yes.
So I'm speaking to Mrs. Young, who has concerns about her 4-year-old son, Jonathan.
Okay. We will start now. Ready? 1, 2, 3, go.
Hello, Mrs. Young. My name is Dr. Kari. I'm one of the doctors working in the mental health services here. How are you doing today?
Hello, doctor. I'm fine.
Thank you. I've just received some information about your son, Jonathan, from your GP, and it seems that you have some concerns about him. Could I ask a little bit more about that?
Yes.
And so that I can understand it a little bit better.
Okay.
So what are the difficulties that you've been having?
Well, in the beginning, we thought that he has a problem in his hearing, but we did all the investigations, and eventually the GP said, no, we must talk with you. That's it.
Right. I understand. So have the hearing tests been done, and are they all normal?
Yeah, everything is okay. All the investigations were done and we're okay.
All right, perfect. Good to know that. So I was just wondering, when did you first started to note that he might be having some difficulties?
Well, doctor thinks he is different from his siblings, and this maybe I feel that he is different since we started to expect from him to be communicating with us, maybe since the age of 8 months, something like this, even before the age of 1 year.
So you think he's not at par with the other children of his age, and obviously with your other children at this particular age, he hasn't been doing the same things. All right. So may I ask, have things got worse since you first noted it, or have
no?
things
He is the same, doctor. I don't think he is not. We felt in the beginning that he is not hearing us. He just don't respond to anyone who is talking to him.
I understand. So it seems things have been really difficult for you. It must be really stressful for you as a mother. So may I ask, have you noticed that he has any particular language difficulties? You're telling me that it seems that
he has never talked. He didn't never talk before. It doesn't talk. He just utters some voices. That's it.
Okay. So how is he communicating his needs with you, if I may ask?
He does not express anything. I know that he must be fed at least 3 times a day. And if I do not feed him, he will not talk, he will not express himself.
That sounds really difficult. Is he able to at least point at things that he would want you to give him?
No.
Not. Okay, that sounds really tough. And how about you're telling me that he makes these different sounds at all the time. Okay. And do you think that these sounds might be calming him down in any way?
No, he just utters these sounds, he just utters sounds, meaningless sounds, but not meaningful word.
Okay. And you know, may I ask, you know, how is his eye contact? Is he able to make an eye contact?
No, there is no eye contact at all. As if he cannot see anyone around him.
Mm-hmm. How is he, Miss Young? You know, when you give him a hug, is he able to come back and give you a hug?
Unfortunately, he does not show any effect.
He doesn't show any affection. All right. And how is he with your other children? You know, does he sit down with them and try to, you know, when they try and play with him, would he sit down and?
No, he prefers almost to play alone. He ignores all the other kids.
All right. Okay. Okay. Have you noticed that he might have any repetitive body movements like flapping hands
exactly.
shaking?
He keeps flapping his hands for maybe for 20 or 30 minutes like this. I don't know why.
Okay, I see. And does he have any special interest in any of his toys in particular?
Yeah, exactly. He doesn't like any toys except those toys who have revolving parts, and he keeps revolving them. And he likes to, you know, to arrange the toys in a particular way and keeps arranging them in a particular way.
Okay, so quite interested in revolving things.
Yeah.
His toy in a particular way. Okay, does he have you ever noticed that he might be sensitive to any loud noises or voices around him?
Yeah, exactly. He's very sensitive to this.
Does he get irritable? Does he sound to be irritable?
Not always, but I feel that he is uncomfortable with this habit.
Uncomfortable with those voices. All right. And can you tell me, you know, have you noticed that he might have any sensitivity to any particular, you know, clothing textures, you know, that he might not like to wear those particular clothes? No. Any sensitivity to any particular textures of food? Does he tend to avoid any particular foods at all?
No.
And how is he at you know, adapting to change? You know, if you
he
say
cannot adapt to any change. It is horrible if anyone changes anything around.
Okay, so that must be really difficult. So you were telling me that, you know, sometimes he can get, you know, irritable or, you know, sound irritable when he's listening to loud noises. Is there any time, Mrs. Young, that he might present as aggressive in any way?
No, not at all. He's very decent. Not
He's very good. Okay. How do you think his mood is? Is he tearful at all?
He does not show any affect of that.
He doesn't show any
affect.
I see. And is there anybody, okay, so going back to when he was born a little bit about that, I wanted to ask, you know, was it a planned pregnancy, Mrs. Young?
Yes, 1 minute remaining.
Okay. And was everything all right when you were pregnant with him?
Yes, everything. There were no problems.
And were there any complications? All right. Okay. Were there any complications when he was born? Was there?
No.
Were you able to bond with him?
Yes.
Breastfeed him?
From my part, but when he grew up, no.
Okay. And, you know, is there anybody in the family who might have a diagnosis of any developmental disorders like autism?
Yes, his cousin was diagnosed with autism.
All right. Have you noticed, Mrs. Young, that he might be always very hyperactive, on the go all the time and not being able to relax?
No.
All right. No. And do you think, you know, how is his intelligence? Tell me about that. Do you think he might?
I cannot say anything about his intelligence. He just doesn't talk.
That sounds really difficult. And does he have any physical health problems like epilepsy or?
No.
Is he on any other medications, Mrs. Young?
Time.
Okay. Thank you so much for talking to me. Thanks.
Don't showboat again. Never showboat again and ask too much questions about texture. And this just demonstrate that this baby has problem. You have time limit. You know too much information, and I think this is related to whatever the source you are studying from. They require for you a lot of things to ask about. You kept asking questions which way beyond the demonstration of the diagnosis. Okay. And you missed important, so you didn't ask about the risk. So it is very common among those patients, those babies, to head bang and hit their heads in the wall whenever they are stressed, the autistic. And it is one of, and I think it is part of the story. You kept asking about the texture, and if he's just demonstrate that he has a problem in the verbal and non-verbal communication, and it is a pervasive developmental disorder since it's time. Number two, just you are so good. That's why I'm very angry. Ask about what is the boy's name? What is his age?
Yeah.
This is how you start. What is his name? What is his age? And talk about him as if he is Tom. What is the name of Tom? How is Robin doing? That's it.
Sorry, because that information was given in the task, so I thought I don't have to ask that. It said he's 4-year-old and his name is Jonathan. That's why I started straight away with Jonathan.
Okay, just start
And
about.
I did ask about aggression. You said that he gets irritable.
It's not aggression. Aggression is some aggression. This means that he is aggressive with someone else.
Okay.
But he might be head banging is something totally different. It's concerns
So I
about
have to particularly ask to be aggressive towards himself. Yeah. All right. Sorry for that.
It was good, but it was good. But you missed at the end to say that this boy has autistic disorder. So I hope that you have the feedback from our colleagues.
Thank you so much for that.
No
Thanks.
problem. So that is the excellent milestones. She asked about the milestones, signposting before asking birth. Well, social history, she asked about doctor. Great job, communication and empathy. Which is very good. Developmental milestones at the end of in the last 1 minute, she remembered that there are important points other than the minor details of the autism.
Yeah,
so
no, I completely forgot to ask about walking, and I know she said that she has language difficulties, but I should have asked about walking and smile and all that. I completely forgot.
Doctor, pay attention to the following. It is not about the diagnostic criteria or the nosology of the disorder which you are going to be asked about, because there are aspects in the history. There are aspects in the history which you should cover to demonstrate that you are an eligible one to be a member of the Royal College or to be a consultant. So don't do the usual mistake that they focus on the nosology and they want to ask about every bit of the nosology, and they forgot the comorbidity, the risk, the family history and post history, and even the living with the diagnosis. Why? Because they focus on the nosology. Okay, you will see in the mark sheet that there is a point for the aspects of the history. It's not only the nosology. Okay, let's see. Okay, so this is how you ask about, you start, how did it all start? You asked about the precipitating and predisposing factors. Here the precipitating and the predisposing factors are the pregnancy and the developmental milestones. And then the course and the duration, it is a stationary problem. And then you ask about the symptoms of syndrome. Now, doctors, in all the cases, in all the scenarios, if you are going to ask about all the nosology, you will not have time. That's for sure. You only have 7 minutes. If you are going to ask about every bit of sign and symptom of every syndrome to demonstrate the clinical diagnosis, you will not have time. Just demonstrate that in autism, he has a problem in his behavior, he has a problem in his verbal and non-verbal communication, and there are some issues related to, particularities related to him, like inability to the changes in the circumstances, and that's it. Don't go in details, otherwise you will miss important points. Okay. And then the comorbidity. You at the end you ask about if he has any attention deficit hyperactivity disorder, and if he has any underlying physical problems, then you ask about this. I don't think that you ask. You ask about how did they are coping with it. Here the coping, how the family, how did the family are coping with his behavior, and if there is any risk, any concerns about his risk or safety. Okay, any concerns about his safety. Unfortunately, you did not ask about this enough in details. You ask about the family history, and then unfortunately at the end, after gathering all these informations and in details as you did, you missed to say that he has autism. After gathering all, so it was very good, but please pay attention again to balance between this the history taking and the details of the history. It is not only about the diagnostic criteria. It's very good, by the way. You are very clever. Have you ever been to the class before?
No, first time giving in Jan, inshallah.
Pay attention to this next time. Thank you so much.
Thank you. Thanks a lot.
Okay. Who would like to go next?
Me.
Okay, Dr. Laila, give me just 1 second to finish this file. Okay, what is your station, Dr. Laila?
It's history taking dementia.
Okay, this is, as we said before, like with Dr. Muhammad Sami, you must ask about the details of dementia, as I said. You don't need to ask about all of them. You don't need, just demonstrate that you have covered enough in relation to the dementia. Don't forget the risk, and good luck. And don't and ask about the onset if it is related to any underlying medical problems, because it can be related to physical problems like the problem of vascular dementia. Okay, 1, 2, 3, go.
Hello, I'm Dr. Nashad, one of the psychiatrists from Mental Health Unit. How may I address you?
You can call me Michael.
Hello, Michael. You are referred here to talk about your wife or your husband?
Well, it is my father, actually, my father.
So it's in the referral memo that you have been that he is experiencing certain memory difficulties. Can you tell me more about it?
Well, doctor, my father now is very forgetful, and yesterday the police brought him. He was being out for 2 days, and the police brought him to our house after getting lost. And I discussed this with the GP. He said that we must talk with you.
Okay, I'm so sorry that he wandered off. From how long is he having these issues?
It has been very, he is now 80 years old. We don't expect him to remember everything. So he has memory problems since about 3 years ago, but now it's too much. He's very forgetful.
Okay, and how did it started? Was there any event or something that happened at that particular?
No, we noted that he, particularly 3 years ago, because he lost his wallet and there was very important papers. But around this time, he was forgetful also. But there was no other reason as far as I remember.
Okay, and how is it progressing? It's getting worse. You have
Yes.
mentioned.
Yes.
Okay.
Yes.
Okay, and is the course fluctuating or continuous? Are there periods of it or that it gets worse?
No, just getting worse with time, doctor, and every time we find that he is more and more forgetful.
Oh, really sorry to hear that. Can you tell me that is he able to remember things that happens minutes or seconds or hours ago?
No, minutes. No, he cannot remember things which happened half an hour. He eats lunch and he said nobody gave him lunch, and he was always forgetful, doctor. Now.
And what about things that happened long time ago?
Well, ironically, he is very good with the old memories.
And is he able to communicate properly with you people?
What do you mean by communicate properly?
Like, how is his speech? Is he struggling with finding?
No. Yeah, he struggles to find words. Yes, exactly, and it's to name the objects like cup and chair.
And what about problems with doing things on daily basis, like tying shoes, etc.?
No, no, no. Even with these minor things, he needs to be supported in.
Mhm. And does he struggle to recognize you people on daily basis?
Not me, but his grandson. He many times he do not know who they are.
Okay, and how are these problems affecting him?
Well, I don't think that he feels that there's any problem. We are the
Mhm.
ones who's suffering.
Exactly. That was my next question. How are his memory problems affecting you people?
Well, now we are always trying to take care of him, but eventually we are not always able to do though. So he's getting lost.
Mhm. So sorry that you're going through a very hard time. How is his physical health?
He doesn't have any physical problem. The GP assessed him and he said that there is nothing underlying problem.
Okay, and what about does he had any mental health problems before his memory problems developed?
No, no, no.
Mhm. And how is his mood nowadays?
Well, I don't think that he cares. He just doesn't show any mood though.
Mhm. And what is he able to sleep properly at all?
Yes, yes, yes. He sleeps, but you know, sometimes he sleep 1 hour in the morning, 1 hour at night, and so on.
So it's disturbed.
Yeah.
Mm-hmm. Right. Okay. Has he ever expressed any ideas of ending it all for himself?
No, no, no.
And what about you express wondering, has he done anything that was harmful to him, like accidental harm to himself?
No, no, no.
Mm-hmm. Oh, is he driving by any
No,
chance?
no, we took for him the keys.
Mm-hmm. Any occasion in which he fell down?
No,
Okay. Did he express any episode in which he was aggressive towards you people?
no, 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 not at all. He's not aggressive at all.
At any moment, is he using any alcohol?
No, no.
Okay. Have you noticed him seeing or commenting on things that are not there?
No, no.
Mhm. How is his movement? Is he able to walk properly, or any other parts of his body are moving properly?
Yes, yes, no problem with the movement.
Have you observed that is there any change in his personality?
One. What do you mean by what?
Like, is his personality, like the way he behaves, is that changed over the course of
Yeah,
time?
yeah. Sometimes when we are with people, he does things which are totally inappropriate.
Okay, so from what we have talked today, it seems like your father is going through what is called memory problem called dementia, and I will give you a leaflet about it. We need to arrange another meeting to talk in detail about it. Is that okay?
Yeah, no problem.
Okay. Thank you for talking to me today.
Okay, very good. Still, you have 30 seconds. How do you feel about what you did? I hope that you
Well,
leave her your feedback, please, in the chat section.
in the beginning, it was a bit confusing because the scenario with me was with about husband and wife, and you told me a name of some man, so I got
What is this?
confused.
What? So you have been treated dementia about the man. This is not definitely an issue to make you confused. It's the same thing because, by the way, many times you might not find a daughter for the patient and they bring you a son and they change the names accordingly. So
Yeah.
you are going to talk to a daughter this time, the same station you will talk to a son. So it is not.
I was about to call you Sandra, and you said something else, and then I was like,
Okay.
how to talk, and that was chaotic.
No, pay attention. Don't copy. That's why I always say to them, do not copy paste. Please do not copy paste. I think this is a very, very common change in the scenario that they bring for you a daughter instead of the son. or a son instead of the daughter, a wife instead to talk about her husband who has dementia instead of a son who's talking, according to the availability of the role players. So sure, this is not a thing to make you confused. Again, doctor, pay attention. You have been very checklisty. Try to do weaving, put a piece of the patient's story in your question. You will be a bit disorganized. The personality is our behavior in the context of others. So when you want to ask about the personality, you just ask, so has there been any change in his behavior while he is present among the people? Okay, so you might do something inappropriate or say something inappropriate and so on. Okay, very, very good. Your data is one. Okay, so sounded like checklisty and developmental. No, this is a great job, careful saying you people, it sounds good. Yeah, so many of them saying that it is a bit checklist. So let's see according to our slide. Okay, so. Okay, but you took the complaint very well. How did it all start? Okay, and how the things before that and how it progressed. Very good. Pay attention, doctors. How the things before the onset, these are simply the precipitating and predisposing factors. And from my experience, that the Royal College always put something in this area for the candidates who know that there are precipitating and predisposing factors. Many candidates do not pay attention to this, and they just go with the onset and forget to ask about the predisposing and precipitating factors, which is a very important thing in our specialty. And then the symptoms of the syndrome. Now, after taking the complaint, you know that it is dementia, but try to be more organized because I felt that you messed up the symptoms of dementia with the risk assessment. Okay. So after asking about the memory, the language, the orientation, okay, the visual spatial, the executive functions, and the personality, you ask about the comorbidity, whether it has any psychological, social, physical. In this area, I felt that you confused everything together. And then the risk, the impact and coping and risk, the past history and family, very important to ask if there is any family history who has dementia, who have dementia, very important in this station. Okay. Past history, if he has any memory, no, there's no past history. You ask about everything. And then you deliver the diagnosis at the end, which you did. Let's see, according to our mark sheet. Again, I'm not an examiner, I'm just telling you how to use this mark sheet. Okay, so don't dwell on my evaluation, just saying to you what to do and what not. Does not identify, you identify the priorities, the complaint, and then the symptoms of syndrome, which is good. The aspects of history, not only the nosology, you took the complaint. I think, did you ask about the comorbid physical problems and psychological problems and social stress? Did you ask about them?
Yeah. Yes. And psychiatric, yes. But social, what should I ask in social?
Who is taking care of him? Okay, at least. Yeah. So any stresses around him and so on.
Not that.
So,
I didn't.
you do explore enough the details of the syndrome. Risk assessment you did. You did assess, so the patient health view, very important to ask well, how can we assess the patient's health view? In this case, it is not the patient, it is the role player. So are you able to take care of him and so on? Because it is very important to pay attention to many things. So if he is the patient, if you are going to talk to the patient in order to score this, you ask him, so what is your explanation for what's going on? But if he is the role player, so ask him, so how are you going to, how did this affect you? And are you able to take care of him and so on? I think that you did not ask this question. At this point, but not be scored for you. Psychological you did, but social you did not, which is very important in this station. So again, this might not be scored for you. Everything was good except it was checklisted. Being checklisted might make you lose 0.8, 11, and 12. Okay, you are very formal and your question style is good and your language is not good enough. Again, doctors, pay attention to the language. It is very important to present, not to miss these 2 points. Okay. Trying to help you as much as I can. Thank you so much.
Thank you.
Okay, thank you, doctor. Okay, who would like to go next?
Me.
Okay, is it Dr. Sheena? Okay, so what is your station? What is your
Body
station?
dysmorphic.
Excuse
Body
me?
dysmorphic.
Body,
BDD.
body dysmorphic
Yes.
disorder, yeah. The one who he has a problem in his eyes, or this lady who has a problem in?
The Mr. Smith has a problem with his nose.
Okay, okay. Okay, let's start. 1, 2, 3.
Can you hear me clearly?
Yes,
Dr. Ibrahim?
yes. 1, 2, 3. Go. Okay, go ahead. 1, 2, 3, go.
Hello, Mr. Smith. I'm Dr. Shah. I'm one of the psychiatry doctors working here. And I understand that you've been referred by your GP to see me.
Yeah, ma'am, I don't want to be rude, but I'm not crazy, doctor. I don't know why I'm talking to you. I thought that he's going to refer me to a plastic surgeon. So why am I here?
Yes, you're absolutely, it's a valid question. It's not unusual for us to see people who want to undergo corrective surgery. So I assure you this is a routine part of assessment. And besides that, we can also help you around any stresses that you might have currently. Can we talk about that?
No problem.
Okay. So what seems to be bothering you right now?
You know, doctor, can you see the shape of my nose, doctor? The shape of my nose. I think that it needs to be corrected by a plastic surgeon. I've read a lot about this, and I understand that there is a problem in the shape of my nose. I know this for sure, and I know that there is a chance to be corrected by plastic surgery.
Okay, okay. How long have you been feeling this way about your nose?
Well, this has been long ago, doctor. Since I was a child, I've been bullied and mocked because of the shape of my nose.
So how many years would it be roughly?
Well, now I'm 30 years, so this might be going on for about not less than 20 years.
Okay, right. Is there anything that happened recently that it made you want to have surgery now?
Well, doctor, I'm sure that my girlfriend left me because of how I look. And definitely her friends were commenting on this and they were just making fun of her because of my look.
All right. So besides you believing that there is something wrong with your nose, would you say that everybody else has also been commenting? You just said that your friends did.
Well, doctor, now the people may be more polite because they are grown up, but you know, I can see it in their eyes. They keep looking at their nose, but nobody is hinting or commenting like in the school, but definitely the problem is there.
All right. So nobody's actually come up to tell you this.
Yeah, yeah.
All right. And is it just the appearance that bothers you, or are you having difficulties in breathing as well?
Excuse me, what did you say? What is the question?
Is it just the shape of the nose? Is it just the shape of the nose that's bothering you, or are you having difficulties with breathing? Okay.
No, only the shape of my nose. Yeah.
Okay. And these ideas that you have about your nose right now, would you say these ideas are your own?
Yeah, for sure. It's not my own, it's the fact, as you can see. As you can see, it is there. I know that you can see it.
Right, right. And is there even a 1% chance that there might nothing be wrong with your nose? Would you agree to that?
Well, I can see that there's a problem, and the problem is causing some difficulties in my life. So I just want this problem to be sorted out. So I think that if I have a problem, my life, if sorting it out will make my life easier.
All right, right. And is it just your nose you're bothered about, or any other body part?
No, just only my nose.
Okay. So, Mr. Smith, help me understand this. You've been having this problem since 20 years. Did something happen around that time that made you believe that there was something wrong with your nose?
As I told you, the kids were mocking me, and with time, I paid attention to it. The problem was there, and I think now, because I am having problem in my emotional life, I need to take an action.
All right. So the kids were bullying you, if I must say, back then, but in your adulthood, nobody's actually come up to you and told you this about your nose.
Yes, exactly.
Okay. So let me understand how this has impacted your life.
Well, I avoid gatherings, and I feel that I'm not confident as I should be, and I feel that my emotional life is way behind what it should be. And now I prefer to do a job in which there is no face-to-face confrontation. I'm a taxi driver and Uber driver. I think this will help me to avoid facing this problem with the people.
Okay, right. Seems like a very rough time for you. Okay, so also help me understand, you work as a taxi driver where you try and avoid people, you avoid gatherings, as I understand. Seems like your relationships have been affected, like you said. How much time would you say you spend thinking about your nose and checking it?
Well, but you know, it's all the time. I need all the time. I'm checking all the time. I'm reading stories about those whose life has changed after doing this plastic surgery. I'm searching on the internet, and I have an idea about how this plastic surgery is done. And actually, if I have money, I could have done it. Actually,
you could have done the plastic surgery yourself?
Yeah, no. If I have money, I could have gone to private section and do it, but I don't have enough money.
Right, okay. And is there any other way that you've been trying to correct your nose, say use makeup?
Yeah, I know. I always put the mask now. Maybe the corona issue helped me to cover this problem.
It seems to have impacted your life quite a bit.
Yeah.
Right, so with all this happening, tell me how your mood is currently.
Well, I'm frustrated. I feel that this problem is there. I want to correct it. I come up with it, and it's affecting 1 minute. And I cannot correct it.
And has your appetite been affected in any way?
No.
Okay. And would you say that you've been feeling so low about your nose that you maybe wanted to end it all?
No.
Okay. And please tell me, is this the first time you're seeing a psychiatrist like myself?
No, this is, yes, this is the first time. But,
yeah. Okay. So, Mr. Smith, as I understand, you've been bothered by your nose quite a bit, the shape of it, and you really want to undergo corrective surgery. It has impacted your life quite a bit, and it has impacted your functioning as well. And these symptoms seem to be consistent with a diagnosis of body dysmorphic disorder. It's quite a mouthful, I understand, but I can give you leaflets to understand. It's a problem where people believe that there is something wrong with their body part. Sorry.
How do you feel about what you did?
Needed to hurry up a bit more. I think
it was very good, but when you talk about, okay, you have the right to be cookie, any psychiatrist like myself, you are very clever, but not the way we assess the past history. Okay, not any psychiatrist like myself. Yes, I've been in contact with mental health services.
Okay. Right. Okay.
It was
Sorry.
very good.
Right.
Other than this, it was very good. So let's see the feedback for our colleagues. Well done. Everything is well. You have a lot of fans here. Okay. Very clever, mashallah. So let's see, according to our slides, then we go to the mark sheet. So you took the complaint in a very good way, how it all started, and you paid attention to, so the story has been going on for 20 years. What made him decide now to do it? So that something happened and you picked it up. Very clever. Okay. And the symptom syndrome, this man is totally preoccupied by this issue. He is spending a lot of time, and he is not satisfied by any reassurance, or that no one is commenting. He is totally involved in this issue. Comorbidity, ask about the psychological, social, physical. I don't think this can be a big issue if you missed it. How did it affect his life? How is coping? Did you ask if he's using any street drugs or alcohol and so on?
No, I was about to ask that with the mood, but I think I missed that. Yeah.
Doctors, please, once you hear the ring of 6 minutes, leave whatever you are doing and start with 0.5, 6, and 7. You can hardly
right.
cover these 3 points in
Yeah,
1 minute. Impact, coping, and risk, how it affect your life, how are you coping
right.
with this? I'm worried
Mhm.
about you. So any concerns about your safety? Do you use any street drugs, alcohol? Okay, any thoughts of harming yourself and so on. Past history and family history, and pay attention how to assess the past history. You don't ask any
Mhm.
psychiatrist like myself. This is the slip of tongue that you are very narcissistic a bit. So delivering the
Sorry, I'm
diagnosis.
sorry. Okay.
Okay, delivering the diagnosis, you delivered it. Okay, very good way. It was very clever. Have you ever been to the CASC before?
No, no, this is my first time.
No, very clever, mashallah. Okay, thank you so much. Okay,
Thank
who would
you.
like to go next? Okay, we had Dr. Sheena, and now I don't know whose turn is this.
Semi, Dr. Hussein.
Yes, is it Dr.
Semi.
Muhammad?
Yes.
Yes, yes, because your screen is totally off, blank. So how are you, doctor? So what
How are
is
you,
your
Dr.
station? What is your station?
Grief.
Grief, abnormal grief.
Yeah.
Doctor, this station, we can say that is 50% communication and 50% decision taking. You should be very empathetic in your tone, in everything you say, because this is a lady who lost her husband and she doesn't have anyone in her family beside her except her husband and so on. So you must be very a fountain of empathy in this station. This is how you pass this station. Other than this, there is nothing particular about it. You are going to ask about the stages of grief, denial, anger, bargaining, acceptance, okay, depression and acceptance eventually, okay. And then ask her if there is any signs of abnormal grief like the mummification, auditory hallucinations, and visual hallucinations, and severe depression or guilt feelings that she takes responsibility of what happened. Okay. And very important to ask her about the support around it and how did she face the ceremonies of the funeral. Okay. Okay. So
What's the name of the patient?
let's say that my name is Mrs. White.
White?
What?
Okay.
What? 1, 2, 3, go.
Hello, Miss White. My name is Dr. Zaina from Mental Health Services. I received a letter from your GP who has raised some concerns about you.
Yes, doctor. He said to me that I must talk with you because I discussed with him the death of my husband.
Oh, I'm so sorry for your loss. When did your husband die?
He died about 5 months ago.
Okay. How did he die? Was it expected or all of a
No,
sudden?
no, it was a sudden. I asked him to bring something from the supermarket, and after 1 hour, he called me from the hospital. He said that there was a car accident and he passed away.
I appreciate how it may be painful for you to talk about such sad events, but would you mind to tell me if you have a chance to say goodbye for him?
No, I didn't have any. Couldn't have a
Did you?
chance. When I went to the hospital, he was dead.
Okay. Did you attend his walk?
Did you attend what?
His walk.
Yes, yes, yes.
Okay. Okay. Have you ever visited his graveyard since then?
Yes, I on daily basis. Yeah.
Okay. Ms. White, when we lose our beloved ones, we may experience a range of emotions and feelings. Would you mind to bitch chat about what's going on with you?
Well, in the beginning, I felt that this is a dream or a nightmare which I'm going to wake up from. I didn't believe that this is something true. But this time, I started to understand that it is true, and I lost him forever. But now, and then I asked, why did this happen to me? We were very good. We used to go to the church, and we used to help the poor people. And why should this happen to me?
I appreciate how it may be harsh for you at that time. Have you cried at all when you informed that he died?
I'm still crying every day, though.
Okay. And did you blame anyone for his death?
I'm still blaming myself, doctor. If I didn't ask him to go out to bring something, maybe I wouldn't have lost him.
You are still blaming yourself till now?
Well, not as before, doctor, but inside me that there can be, I might be responsible for something.
I understand how you may feel, but I see that you shouldn't blame yourself because you are not responsible for anything. So, did you ever wish that it was you?
No, no, I don't think that this would have been a solution for it. Still, I would lose him anyway.
Okay, Ms. White, I understand how the past 5 months may be difficult for you. How would you describe your mood recently?
Well, I'm always sad. I feel that I'm always sad.
Are you still interested in things you used to enjoy?
No, no, no. Because everything I used to enjoy it with him, and now I cannot do anything alone.
Are you sleeping well?
No, no, I can hardly sleep.
What about your appetite?
I'm not, no. My appetite, I eat, but not as before. Maybe I lost 1 kilogram over 5 months, but still, I don't think that I'm eating as I used to eat before.
I understand how you may be feeling so hard now. And how do you think you came to the terms of your loss?
I think that I'm about to understand that he died, but I feel that I'm not able to accept it.
Okay, you couldn't able to accept his absence till now.
Yes.
Okay, regarding his belongings, how did you manage them?
Well, I did what I think it would have been his wish. I gave everything to the poor people.
Okay, and did this make you feel comfortable?
Yes, yes. I think because I think this what would be.
Okay. Have you ever seen your husband around after his death?
No, no, no.
Okay. Did you hear his voice talking to you?
No, sometimes I hear as if he's calling me, but I know that he's not there. But from time to time, I hear him as if his voice is there.
But you know that he's not there.
Yeah.
Okay. I would like just wonder to know who is able to support you when you feel low.
No one around me. No one around me.
Okay. How has this impacted in your relationship with your friends or your relative?
What?
How has this impacted in your relationship with your relatives or your friends?
Well, I'm not joining any gatherings. I prefer to be alone.
Okay. How do you usually cope with your stressors?
Well, I just I don't know what to do. That's why I went to the GP.
Did you ever take any alcohol or recreational
1
drugs?
minute, 1 minute remaining.
Did you take any alcohol or recreational drugs?
No, no.
Okay. After your loss, have you ever thought that you don't want to carry on in life?
No, no, no. I feel that this wouldn't have been his wish.
Okay. Any financial problems you are experiencing after your loss?
No, no, no.
Great to know this. Thank you for sharing this information with me. Is this the first time to see a psychiatrist, Ms. White?
Yes.
Okay. Ms. White, from what we have discussed, it sounds that you are passing with some process after your loss, which we call abnormal grief, and also you look depressed. I would like to offer some help for you, and there are some charity organization like Rose organization which can help you to come to terms of your loss. What do you think about this?
Okay, no problem. Time. Thank you so much. Very good. So,
Thank you.
do you feel that it is abnormal grief? No, it is not abnormal. She has depression, and this.
She has depression.
It is you are passing through the stages of grief. Okay.
Grief, yes, normal.
I think there is something called grief support. Maybe
Cruise.
our colleagues who work in UK. I think there is something called grief support.
There is cruise.
What?
Cruise.
What is cruise?
Charity organization.
No, not charity organization. Just grief clinic, something like this. Maybe our colleagues.
Maybe.
But definitely there is some sort of a group therapy which can support with psychotherapy. Just you can say that we can help you with group and psychotherapy.
Okay.
Grief, yeah. Say bereavement counseling, yeah.
Okay.
Grief counseling, say bereavement counseling, yes. Thank you, Dr. Devi and Vijay. Bereavement counseling and grief counseling services. So this is how you terminate this. But everything was okay. Very good, by the way. Very excellent. I didn't write anything in your. If any of our colleagues has any comment, please write it in the chat section. So let's see. You took the onset, how it all started, the progress, how did it progress, and so how were you doing before that? You just asked me. So before this. I wish that you ask her, so before this unfortunate loss, can you tell me, give me an idea about your life with your husband, were there any stress? Doctor, it's very important to ask about the period before the onset, because in this area, they put a lot of things, from my experience. This is the area where the Royal College put a lot of things, and unfortunately, many can dismiss them. So ask always, so before this unfortunate loss, how are you doing with your husband? Any stresses, anything? Just show to the examiner that in your mind there, you know that there could be some precipitating and predisposing facts.
Okay.
So symptom syndrome, you asked about the denial. So did you ask me, so the stages of the grief, denial, anger, bargaining, depression, you just verbalize, so have you ever felt that this is not real and this might be some sort of practical joke and so on? Have you ever felt at any time that you're angry because this is the fate of your husband? So please, I think this is a point which you should have demonstrated, that you know the stages of the grief. Though I felt that you did it very well, but show to the examiner that you know that there are stages: denial, anger, bargaining, depression, and eventually the acceptance. Comorbidity. Did you ask about? You asked about the psychosocial. You asked physical. Please ask about. You missed the physical. Very important to ask about the physical. Impact, coping, and risk. You asked about. Did you ask about past history and family history? If she has been in contact with psychiatric services?
Yeah, I asked if this is the first time to see a psychiatrist.
Yes. Okay, and delivering the diagnosis. Everything was good except that while you just try demonstrate that you know the anger, the denial, the anger, the bargaining, and etc. And the physical. Everyone, but all in all, I felt it was good for me. I think this is a pass for you, the good pass. But again, I'm not the examiner. Okay, so that's not. So you identified the issues and priorities. You paid attention to the aspects of history. Unfortunately, this point might not be scored for you because you did not ask about denial, anger, and etc. Point number 3 does not demonstrate adequate risk skills. Did you ask about the risk, which thoughts of?
Yeah.
So very good. Sufficient attention to the patient. I felt that you were paying attention and empathetic. Psychological and social information you paid attention to. It was organized, very good consultation management, not formalic, everything in your communication was good. So I think though you did not pay attention to, so this is very good, doctors. Pay attention to the mistake which Dr. Muhammad did, though he did not, for me, he did not cover the symptoms of the syndrome. So it's the nosology, denial, anger, but he missed only one point. He missed only one point. And most of the candidates focus on the nosology and forget everything else. Dr. Muhammad did not ask about denial, anger, but so he missed only 1 point. 1 point from the 12 points. Pay attention that there are other aspects in the history other than the nosology. Okay, thank you. Very clever, Dr. Muhammad. Very clear.
Thank you, Dr. Sam. Thank you.
Okay, so who would like to go next? Okay, are we finished? Okay. Thank you so much, doctors. Very clever. But this is only 50% of what you should do. Now you know how to do these stations. The next 50% is to prepare with your study partners. Wish to see all your names in the box list. Have a good night. Thank you so much.